Hi, I'm Claire Pearce. I'm the Director of Nursing and Midwifery in NHS Tayside, and I want to talk to you today about personal protective equipment. As you know, there's been a lot of things said about PPE recently, and I'm here today to tell you what to wear and when. The first thing I would like to say is there's adequate supplies across NHS Tayside, so there's enough stock for all staff who need to wear it whenever they do. If you're providing direct patient care, i.e. within 2 metres, and you're not carrying out an aerosol-generated procedure, then you will wear a fluid-resistant surgical mask for sessional use, disposable plastic apron, and disposable gloves. The apron and gloves should be changed in between patients. If you're carrying out an aerosol-generated procedure, then you need to wear full PPE, and that is an FFP3 mask, which you'll have been face fit tested for, a long sleeve gown or apron, disposable gloves, and eye protection. If you're going into a clinical area and are not providing direct care, but it's difficult to stay the 2 metres away from either staff or patients, you should wear a fluid-resistant surgical mask for sessional use. That's for people like porters, domestic staff, and outpatient staff. If you have no direct patient care, like staff who are working in offices, then no PPE is required, but physical distancing of 2 metres must be maintained. Hand washing advice has been updated to include washing of forearms, where forearms have been exposed or may have been exposed to respiratory droplets and other fluids. And obviously, the 20-second rule continues to apply about hand washing. Thank you very much for listening, and full guidance will be available on StaffNet.